Hello, I am Dr. Kalila Jefferson, DNP. Let's talk about something that is no longer rare, no longer hidden, but still not fully understood: the dangerous intersection of teen mental health and illicit drug use. Because today, this isn't just about experimentation, it's about survival. Teenagers are facing rising levels of anxiety, depression, and emotional distress. And without the tools to cope, many are turning to substances, not to get high, but to feel less anxious, less overwhelmed, less alone. But here's the reality: what feels like relief is often the beginning of a downward spiral. Substance use doesn't treat mental health conditions, it intensifies them. It worsens depression, increases anxiety, disrupts sleep, and in some cases can trigger psychosis. And the stakes have never been higher because the drugs teens are using today are not the same as they were even 5 years ago. From 2019 to 2021, teen overdose deaths more than doubled, even though overall drug use did not increase. Why? Because the drug supply has become more dangerous. Fentanyl, a synthetic opioid, is now involved in up to 79% of teen overdose deaths. And many teens don't even know they're taking it. Counterfeit pills, made to look like prescription medications, are often laced with fentanyl. It only takes one pill to be fatal. This is why we are seeing a rise in accidental overdoses, not addiction, not long term use. One experiment, one pill, one moment. And tragically, in 2023 alone, over 1,500 teens aged 15 to 19 died from drug overdoses. So, what can we do? First, we must normalize education, not fear. Teens need real information that any illicit pill could contain fentanyl, that mixing substances increases risk, that mental health struggles deserve treatment, not silence. Second, we must talk about naloxone, Narcan. Narcan is a medication that can reverse an opioid overdose in minutes. And here's what's critical: in many overdose situations, someone else is present but doesn't act in time. Narcan is safe, it's easy to use, and it saves lives. Communities that increase access to Narcan have seen overdose deaths drop significantly by as much as 50% in some areas. This is not enabling drug use. This is preventing death. And third, we must expand access to treatment because behind substance use is often untreated anxiety, depression, trauma. Evidence shows that early intervention, therapy, counseling, and when appropriate, medication assisted treatment can significantly reduce both substance use and overdose risk. But here's the problem: fewer than 1 in 3 teens with opioid use disorder receive any treatment. That is the gap. That is where we are losing them. So, this is not just a drug crisis, it is a mental health crisis. And if we want to save lives, we must treat both. We must replace silence with conversation, punishment with support, and fear with knowledge. Because when we give teens tools, connection, and access to care, we don't just prevent drug use, we interrupt the spiral, and we give them something stronger than any substance: a reason to stay. Thank you.